Thank you.
Hi guys, good afternoon. How's everyone doing today? We're here with our amazing Dr. Gurani today, you guys.
Hi there, how are you? And nice to be back with another live. All right, Penelope, let's answer some questions, please.
So we got the questions ready. So, how will pregnancy or weight gain affect my surgical results over time?
Okay, fair enough. So if you're talking about a BBL, you can gain some weight during a pregnancy, and I think from the feedback that I had received from some patients, it does not ruin the result, but patient's skin gets sometimes loose, so you might end up having to have a tummy tuck after that. But it all depends on how your skin responds when it comes to the skin laxity. And then in terms of the weight gain, because we left you with a very nice shape, good contours, good proportions, you should go up and down proportionally. I've had patients come back after a pregnancy, and they said, after about a year of trying to exercise and lose weight, that they still want a touch up, and that's reasonable. It will sometimes require another round of lipo, but again, I've not seen it damage your result. In terms of a tummy tuck, sometimes it does stretch the skin, and you might need a revision, but I always encourage the patients to wait at least 6 months to a year before making their final decision on what to do with their breast and their tummy skin after a pregnancy and lactation. So don't jump into surgery really quick after a pregnancy. Let your body go back to its pre-pregnancy state, diet, exercise, and wait and see what happens to your skin.
Great. So, doctor, we have here from Hair by Jay. Hi, Dr. G. Thank you for everything.
You're welcome.
And then we have Dennis here. Dr. Gurani, what is the highest BMI you work with?
Okay, so as defined by the state of Florida Department of Health, we have to stay under 40. So 40 and under, please. And I don't like the BMI, so I like to see your distribution, but I have to cut it off at 40 and below.
So we have here still First Lady, great doctor, I love my results.
That's awesome.
We have Wyo, he's so handsome. Thank you guys, thank you. Kennedy, appointment is 12 days away. Okay.
All right, we're looking forward to seeing you. Come on down.
We have another question here. I'm 6 weeks post-op. Can I take my faja off for rest time?
Yeah, you're allowed to. You can take your faja off, take a shower multiple times a day, clean the faja, put it in the dryer. Being out of the faja for an hour or two is not the end of the world, okay? And you're, 6 weeks? You can take some break. I recommend it for at least 3 months, but I understand you can feel suffocated with it, and it's uncomfortable as the weather's getting warmer. So yes, take some breaks, but not more than 2 to 3 hours at a time.
So we have a question here that says, which implant type, saline versus silicone, is best for my body type and lifestyle? How are they different?
Okay, so I think that the gel implants, the silicone, are the most natural feeling implants. I prefer them. If I had to choose, I would choose silicone implants every single time. They feel the closest to your own natural breast tissue. Now the saline is obviously, if you're on a budget, they are cheaper, but they feel harder, they are less natural. I think sometimes you can hear the fluid swishing in there. The saline implants end up being heavier than the silicone implants, and I think because of the water moving back and forth, they could cause the skin to stretch more. So that's really in a nutshell. Without going too technical, I really prefer the gel implants over saline implant any day.
So we have here from I Am Brisha, what advice could you give patients if they are scared? LOL.
Okay. It's very reasonable for you to have some anxiety and to be uncomfortable with going to sleep under general anesthesia for a procedure that is an elective procedure, not a procedure that you need. It's not an emergency. Nobody really needs plastic surgery, but we want it. So it's reasonable. But what will make you feel comfortable? All right, so I've seen your pictures multiple times. I have approved your case personally. Nobody gets through to surgery without me seeing your pictures, giving my comments, and I'm sure you've had that experience where the salesperson or my pre-op coordinator has called you back and given you my feedback and asked you to modify something or told you that I approve it. Second, we send you to your primary care physician. You get a medical evaluation, physical exam, history and physical. Your labs are reviewed by me directly. They're passed down to me by the pre-op department. If there's a CT scan or an ultrasound or a mammogram, I'm reviewing all that. So seeing that I treat this as a true medical specialty, this is not just cosmetics. We don't take this lightly. I take this as a medical specialty that enhances and restores form and function. So that's where your confidence should come up. And once you meet me, whether you're seeing me online or you're seeing me in person, I think it's a matter of asking your questions so that you can lower your anxiety level, and they can be as technical as you want to. The office that we're in is state certified. The anesthesia providers are all board certified, and some people that we're interacting with on a daily basis, we know their skill set, and the equipment is standard state-of-the-art equipment that would be used at a regular hospital. So I hope this answer helps without going into too much detail. If you have a specific point that's giving you anxiety, please go ahead and ask those questions in the comments down there, and we can help you either dispel some myths or agree with you on figure out what's making you anxious.
So we have a comment here from Shakila that says, I am 8 years post-op BBL and I refer so many people to you, I still look good. Oh.
So 8 years post-op, Shakila is still happy with her result. That is a testament to good technique and good patient care and good procedure that is being done consistently by somebody with experience. I know that sounds like maybe I'm tooting my own horn, but look, 8 years later and patients are happy. Not everybody responds the same, but it's very comforting to know that what I'm doing is working and it's lasting a long time. And I do get questions where people say that I had hips placed and they went away. Everybody's different, everybody metabolizes and heals differently, but I think, knock on wood, I'm happy with my technique, and it seems that the results are lasting long. So thank you for the feedback. I really appreciate that. It's good to have it online like this for other patients to hear.
Yes, sir. Do you know how to fix a chicken butt deformity? Have you ever worked on someone with a slight chicken butt deformity?
Yes, a lot. A lot of patients have that because of just the way they grew up, their body developed, their skin. The chicken butt deformity is partly because also kind of out to the side, past the area where they call the chicken butt, there is the pelvic bone presses up against the skin, and that gets rid of fat, especially if you have a desk job and you sit there a lot. So it's an area that's kind of closer to the bone. What I do with that is I try to reduce the fat that's closer to the middle, to reduce that little chicken butt looking thing, and add fat more towards the outside and the midline of the butt so that it can round out and hide that contour. So yeah, I work with it. There's ways to help fix it.
So we have a question here from Loyal Jade. If I get my BBL done June 20th, would I be good on July 23rd for my birthday?
Yeah, a month of healing. If you're diligent with going to your massages, doing your own massages, you should be able to celebrate your birthday in a nice dress. I wouldn't be too crazy and wild, but hey, I think a dress and high heels and a nice party is reasonable.
Oh, wow.
Be safe.
This is a very nice comment. I'm 3 years post-op. I had a baby and immediately snapped back, looking to come back for round 2 with Granny.
All right, well, congratulations on the baby, number one. I'm happy that you guys are both doing fine, and I'm glad to hear that you're snapped back very well, and we'll be more than happy to review your pictures and see if we can give you even more enhancement.
4 years post-op, Dr. G still looks amazing. Second round lipo days October. Okay, you
All
guys.
right, we'll see you in October.
Yeah,
That's
we have
awesome.
lots of patients that are coming in very
Awesome.
soon.
Awesome.
So, this question says, am I a better candidate for a lift and augmentation or both? How can I know?
Okay, so why do you need a lift? Why do you need augmentation? You know, it's volume. The reason we need an augmentation is to have more volume. Now, an augmentation alone, that means your nipple is in the right place. It's the distance between the top of your breast and the bottom of your breast is even, they're equal, and the nipple is kind of pointing forward and to the side a little bit. So that's one of those cases where you need an augmentation. Now, when the nipple starts going further and further down, then yes, that's when it's time to do a lift to put the nipples more pointing forward, not towards the floor. And would you choose an implant with that or not? Depends again on how much breast tissue you've lost with time, age, weight loss, lactation, childbirth, and so forth. So it's basically that in a nutshell. Implants are for volume, to fill up the top of the breast, give it projection, and then the lift is to restore the position of the nipple to a more youthful place.
Yeah, so if your nipples are kind of, you know, I guess pointing a little more down, that means that
Yeah, the lift is helpful. Now, that is a very quick answer. Every case has a little bit of a different nuance. You got to look at the distance between the nipple and the top of the breast, the nipple and the bottom of the breast to figure out where the extra skin came from. So please, you know, allow us to have pictures and or even better, an in-person evaluation to be able to give you a better answer.
So, Chrissy, how can I get a consultation? So, love, you could text us through DM here on Dr. Grani's Instagram. You could text us through DM. You could also go ahead and leave your information right there. That way we could go ahead and get in contact with you. And that way we can schedule you for a consultation.
I answer all my DMs. I have a generic template that I will send you. And if you send me your name, email, and telephone number, I'll send it I'll forward it to the pre-op department, and they'll call you. The sales representative will call you.
Yes, yes. So, Hello Kitty, Minash, should I gain weight before my BBL if I want my thighs to be bigger for fat transfer?
No. I will never recommend that anybody gains weight. Rarely do I ever have a problem finding fat for a fat transfer, for hips, and for projection. Send us your pictures. I'll be able to give you advice. Include your height and weight. That would be helpful. A picture of the front, the back, and the sides with your arms forward so that we can tell where your fat deposits are. But no, don't gain weight before I will rarely ever ask for that, but I will be the one that specifies. I'd rather you stay as healthy as possible.
So we have a comment here from the Trendy Mommy. Love his demeanor, so welcoming. We're looking to book soon.
Thank you. I appreciate it. What you see is what you get. This is the real me. There's no rehearsed act here.
Shakila says, Dr. Gurani, his team cracked and joked to make me feel better, and I loved it. Trust me, you all will be fine. Thank you so much, Shakila.
Thank you, Shakila. Thanks for the constant feedback. I appreciate it. It's very helpful.
Simply Toya has a question. Can you lay on your back after fat transfer to hips only?
If it's really isolated to the hips, yes, I'll let you lay on your backs. But a lot of times when I fix the hip, I kind of have to transition to the back a little bit. Let's talk about it in person. If it's really isolated to just the hips on the outside, yes, you can lay on your back. But please don't quote me on that until I see you individually.
Hi, Dr. Gurani. I have a second round BBL scheduled with you in a few months. What are some things I can do in order to prepare for it?
Okay, I want you to make sure that you're eating well, high protein, low carbs. I want you to make sure you're taking iron supplements and vitamin C. I want you to boost your hemoglobin as much as possible. Stay away from all alcohol, stay away from smoking, tobacco of any form. And do some exercise. Try to get as fit as possible. Go to the gym, lift some weights, resistance training, and do some cardio at the end of your workout session to make sure that your lungs and your heart are in good shape. And try not to gain weight, like I said a few minutes ago.
Hey, Dr. Gurani, 8 years post-op from Joy 100.
Wonderful.
That's
8 years. Today is the 8-year mark for a couple of patients.
Yeah.
Congratulations. And please send us updates on my Instagram. If you're comfortable us posting you, please indicate. And I'll try to go back into my photo album and find you, and we can do before and after pictures and put a comment there. I appreciate that. It helps other patients in the community make up their decision, make up their mind about the procedure.
Of course. Are you working on patients who is on blood pressure medication?
Yes, I do. If you are on chronic blood pressure medications and your blood pressure is under control consistently, I do recommend that you have your own blood pressure machine at home. Take them when you wake up. Take the blood pressure halfway through the day and in the afternoon, and keep a record, keep a log, and please share it with me when you get here. You want your blood pressure to be controlled because you don't want to have uncontrolled hypertension and go through this procedure. As a matter of fact, if it's uncontrolled before you go to sleep, I will not put you to sleep if you're not a controlled hypertensive, and that's something that you can manage before you get here so you don't waste your time.
Of course. Hey, can you get fat added into the thighs?
The outside thigh or the inside thigh, if it's necessary, yes. If it's needed.
That's great. We have a question here that says, are type 1 diabetics allowed to get BBL surgery?
Yes, I've done a few type 1 diabetics. A lot of people now are walking around with the Dexcom monitor that's attached to their arm. We keep it on. We download the app onto our iPad, and we're watching you from beginning to end. You give us your your injectable anti-hyperglycemic, and we can manage that while you're sleeping, and we'll follow that with you in the post-operative. Obviously, try to keep tight control on your diabetic medications and your numbers before you get here. The better your hemoglobin A1C is before you get here, the better.
Of course. What percentage of the transfer fat typically survives long term?
To give you a good number is very hard, but there was a research from a long time ago in the lab that showed about 28% fat loss, but those were animal models. So it's kind of very hard to tell you exactly what the numbers are. It's very hard to get patients back to do MRIs and measure the amount of fat that's retained. But I can tell you that the technique I use, and you've heard from patients a few minutes ago that they've had 8-year results and they still look good, that my fat transfer patients are happy and their fat is actually staying, and it's, I think, technique dependent. I don't want to get into the weeds with the technique, but I think the survival rate is very good if you know how to distribute the fat properly.
Of course. Can a belly really get rid of my cellulite, and how does this work?
Okay, a belly. So what is cellulite? Cellulite is a fiber, connective tissue that attaches the dermis, the deeper layers of the skin, down to the muscle. Okay. And it's like little pillars that go from the ceiling to the floor, and that tissue pulls onto the skin, and you get dimples. And these are the dimples that will not go away when you put the skin on tension. So if you have a question about it, just know if it's just loose skin or a true dimple. The dimple will not disappear. True cellulite will not disappear when you put the skin on tension. You'll still see that dimple. And Avelli works. The reason Avelli works very well is because as I introduce the Avelli through an incision, until I get to the point where the dimple is, I'm not really traumatizing the tissue a lot. And then I open the Avelli, and the small knife that's on there helps me cut the tissue that's holding the dimple down without traumatizing too much tissue on the way out. Okay, so I like it because it's not as traumatic as using other instruments that I have with me that I've used before to take care of cellulite that are a little bit more traumatic. This is the sharp part of it can be actually protected on the way out, so it's not cutting on the way in and the way out. It's not cutting unnecessary tissue.
And I saw a patient that actually got a belly a couple weeks ago. She looked amazing, you guys. Yeah. Amazing. Like
it works. It helps.
It helps.
But please understand that it's not the solution for all the skin ripples. It's only specifically for dimples that don't go away when you put the skin on tension.
So we have here a comment from Daniela Lebron. Dr. Gurani did my surgery and my sisters in the beginning of April. We love our results.
Awesome. Nice to hear from you. Okay, update me with some pictures. I'm curious to see how you guys are doing.
We also have here a comment from Ariona talking about that she can attest to that, talking about how you have an amazing technique
Thank you.
to the fat transfer.
Thank you.
So, what are the long-term maintenance needs for breast implants? What are
Okay.
some things?
So there is a lot of first, you always need to get, if you're of the right age, you need to get mammograms and if need be ultrasounds. Okay, you always have to do your own self breast examination. Okay, and your breast your OBGYN or your primary care physician can teach you how to do that. Get your annual exams, so you get a breast exam and your GYN exam yearly, and that includes examining the breast for any masses. So that's one. So don't ignore the breast tissue that's above the implant. Okay, treat it like any other breast tissue that you do with without the implant. Now the implant itself, okay, most implants now are very durable. They're 5th generation implants. The silicone is high grade 5th generation silicone. They guarantee the implant. Most companies guarantee them for 10 years, and you can even buy more warranty. What you should do is you should always know how your implant feels. If you start seeing that the implant is higher, for example, or all of a sudden the pocket gets bigger, then you need to investigate with an ultrasound to see if there's fluid around the implant. There's also recommendations by the companies that after 2 years you should get an MRI, 3 years after that, so 5 years an MRI, 7 years an MRI. It's a very hard sell, to be honest with you. We let the patients know that the standard of care is to follow with an MRI, but it's very expensive to get an MRI, so I understand a lot of patients don't do that, but that's what companies recommend, that you do that. But you know, the implants, the silicone implants, I'm talking about the smooth, round implants, are very, very safe, and they've had a very good track record.
That's very true. We have here a question from Jabri. When do you recommend sitting after BBL?
Jabri, I think that we've talked about this, and we have, the recommendation is to wait at least a month, if not 6 weeks. Okay, guys? And even then, I would use the booty pillow right above your knee and give your lower back a break by putting a pillow behind there so you don't fall backwards, and you give your lower back the support.
At what age do you stop doing tummy tucks? From Mrs. Hodge.
There's no age for that. What I look at is if you need a tummy tuck, first of all. Second of all, your health status. I have to see how healthy you are according to your age. So, you know, if you've ignored yourself and you have a lot of comorbidities, hypertension, diabetes, and you're just 40 years old, again, you know, we have to treat you with caution or recommend against it. And I've treated patients above 50 into their 60s with a tummy tuck, but if they take care of themselves and their heart and lungs are good and their kidneys are good, I don't see a reason why not to help a patient with extra skin.
Of course. How do you tailor the BBL shape to different body types? For example, for people that naturally have an hourglass figure, or for people that look a little more square, or for people that have more of an athletic build?
Okay, so that's a good question, because it just tells you right there that there's no cookie cutter. Okay, there's no rubber stamp that you just go on from one patient to the other. Everybody's built differently. The torso is different length. The pelvis is different shapes. There is the wide pelvis at the bottom. The hips are wider. They're easier to work with. There's the people with a wider waist. There's the more straight profile. So what I have to do is look at the annoying fat deposits like the anterior abdomen, clean the flanks, expose those nice feminine curves, go to the love handles, clean those, the bra rolls. I do recommend sometimes to also go above the bra roll where the fat is under the arms. So basically cleaning the tissue, the fat tissue that's under the skin, to expose your natural anatomy. Now, some girls have a smaller rib cage as it transitions into their waist, and you can accentuate that on everybody, but some people have a wider that area is wider, and it's harder for us to get that nice hourglass. And so the idea is to define the waist, remove those annoying love handles. So we expose your anatomy, we expose your pelvis, your true shape, and then focusing on the projection and the hips, so that we can blend your hips with your thighs. Sometimes I actually have to add fat, not just to the hips, but to the thighs, to give that parentheses, feminine gynecoid shape. So no, I know that everybody is different, and I know some are easier than others, but the idea is to expose the waist, to get rid of the love handles, to recreate what's been hidden, or to expose what's hidden with fat tissue, fat deposits, and not be scared to add fat to areas that will enhance that. Now, it's not about only adding, like I was describing earlier in the conversation to answer this question, it's about what you take away. Now, you're gonna get some ladies and women that are just naturally, like I said, very tight waist, and just cleaning that gives them that amazing, they pop out. And it's, unfortunately, some people are more straight up and down, and it's harder. And the hardest case is the people with a very, very, very tight, narrow inferior buttocks, very straight hips, and they keep more of their fat centrally, and they have a wider pelvis at the top. And those are more challenging, but there's always a solution. And some people are candidates for one BBL, and some people have to come back for another one, because the skin is another challenge. Some skin is more relaxed, and we can fill it up easier. Some skin is a lot tighter, and it's harder to expand. But remember the thing I always say, it's not always what you put in, it's what you take out that also helps expose the shape.
Good. It's an amazing explanation, actually. I'm gonna say that on my life. It's an amazing explanation.
Just give me credit.
Yeah. You guys heard it here from the GOAT himself. Okay. Do you operate patient with MTHFR/RA?
I don't think that's a very good idea, I guess. Okay, that's there's certain diseases or syndromes that it's not a very smart idea to go to sleep. Yeah. Okay.
So, Juicy Jiffy, I tried gaining my metabolism too high. Can you recommend any weight gainers? You guys, it's not recommended for you to gain weight.
Send me your pictures first to see if you're, like I said earlier, I don't like people to gain weight, but send me your pictures individually, and I'll see if you really, really need to gain weight, because we can always find some fat.
He did me so well, y'all. The hype is real. He's the GOAT. I know.
Thank you. Thank you. I appreciate it. That's a vote of confidence that I really appreciate.
From the same girl, she said, "Oh my God, look at my handsome doctor."
Thank you.
How long, from I'm Simply Toya, how long do you stay after tummy tuck if you're from out of town?
Please stay at least 7 days after surgery. 10 days is ideal for tummy tucks. We get to take care of you. You can, we can show you how to take care of your tummy tuck incision, your drains. You'll get the benefit of doing some massages with our massage therapist. I don't recommend tummy tucks get aggressive massages like the ones that we do for the BBL patients, but it's helpful to show you how to massage the area where the tummy tuck is done. You will leave here eventually feeling more comfortable and ready to kind of take care of yourself. And sometimes by the 10th day, I can remove your drains on the tummy tuck, and it will make you feel much more comfortable if that's done over here. Doesn't mean we can't do it if you leave with them, but there's a lot of benefit for you guys staying close by to get the interaction between myself and my nursing staff and my massage therapist.
Of course. So, it's brown sugar. How long to stay for second round BBL from out of town? At least 7 days, you guys. Okay.
For the BBL, 7 days, please. Yeah. After surgery. So don't count the pre-op day, and don't count the surgery day. Those don't count.
Yeah. So we have a question here. How long does a BBL and lipo surgery take?
Anywhere from 1.5 to 3 hours, depending on the size of the patient, the difficulty of the lipo. Not everybody is made from the same mold, so that's anywhere from 1.5 to 3 hours.
We have a question here from Electric Babe. Is the upper back included in Lipo 360?
Above the bra line, no.
No, you guys, but
from
that's
the brow line down.
that's the section that you could add though. You could add it, you know. So important that you guys know that. So we have the same question again. Can you please explain why MTHFR is not a good choice?
DM me and I'll explain to you privately.
Yeah. So we also have questions here. Okay, DM you the pictures. Yeah, you could go ahead and DM him the pictures.
Yeah, you can. You can. I always like you to DM me your name and an email and phone number so that we can get you in contact with the office so that we can create an official medical record so that we have all the information in one place, all the emails in one place, because it basically reduces confusion. Okay, this is my direct message, my DM, my Instagram that I only see. So it's easier if we can get that type of information. I don't mind giving you a quick answer on the direct message about your pictures, but the DM is not the right place to give you a formal evaluation, okay? But you know, a few words is not a problem, but it's better for us to get you a proper medical record. Everything is confidential, everything is encrypted, so don't worry about it.
So we have a question here from Hello Kitty Minja. Do you recommend fat transfer to the breast if you're afraid of implants?
No. That's a quick answer.
Yeah.
I'm not a very big fan of fat transfer to the breast, a global fat transfer. I know some other doctors around town do it. The thing is, I have done fat transfer to the breast before, but not as an augmentation, but as a way to hide implants on, for example, breast reconstruction patients that have had a mastectomy. We did implant reconstruction on them, and they have a stuck on look, like the implant is very obvious because they lost all the breast tissue. With those people, with those patients, I put like a crescent shape amount of fat on the inside of the breast, around the implant and on the top, to hide the profile of the implant so it doesn't look too fake. But global augmentation, I'm not a very big fan because I still feel like it can confuse or hide or camouflage a breast cancer that might be lurking in there. I know other doctors will disagree with this and say that there's high resolution MRIs and CT scans, but I still think that is a risk that I don't want to take.
So we have a question here from the real.
And also implants look better.
Yeah, they really do, you guys.
Yeah.
Especially for projection, it looks really nice. So she has
Or as a matter of fact, that if you have a lot of breast tissue and you don't need the implant, we can do a breast reduction lift or just a lift, and we can use your own breast tissue to remodel the breast and make it look perky. And a lot of times, depending on the size of your breast and the position of your breast on your chest, I can make them look like they were augmented, so with your own tissue. So you don't necessarily always need an implant, but I also need to see your pictures so I can weigh in and give you my opinion.
You actually just did that to Silver.
Yeah.
She looked so amazing.
Yeah.
You guys, he recently had a patient. We posted her actually on the Icon Cosmetic Center Instagram page. She looks so amazing. You would think she got a breast augmentation. She actually got a lift. So
yeah,
amazing.
You don't always have to use an implant. I just need, the disclaimer is I need to see you and your pictures to be able to tell you if I can do that.
Of course. So the real is asking if she could get back lift with BBL.
Back lift.
Back lift.
Okay. I don't know what you mean by back lift. You're talking about the circumferential tummy tuck. Usually big incisions like that, I don't like to do with a BBL because you're compromising the blood supply. Okay. But anyway, send me your pictures and point out to the areas that you're concerned about, and we'll talk about that. You might be just a candidate for more lipo and J plasma, which will tighten your skin. Okay.
So we have a question here from Michelle. Hi, why do lupus patients get denied?
Lupus patients?
Yeah.
Okay. Well, that is not totally true. Okay. I need to know where on the spectrum of lupus you are, what organs in your systemic lupus are involved, because lupus does not involve one organ or one system. It can involve multiple organs, and I need to know what's affected: your kidneys, your heart, your lungs, your vessels. So it is for your safety. Patients with lupus can have increased chance of having blood clots, but again, it's a spectrum. Not everybody's the same, and not all organs are affected equally. So, with your rheumatologist evaluation, your record, we can see how high your risk is, and how advanced is your lupus, and how many parts of your body it's affecting. So, it's an autoimmune disease that increases your chances of having complications, and that's why some patients are not good candidates. Nobody's rejected. It's just we're looking for your safety, your health before your vanity.
Always a priority. We have 2 comments here. I love his work. And then the other comment is, I'm ready to come back. It's been 4 years in November. Stomach still snatched.
Awesome. Thank you for your compliment. See you soon.
We have a question here. How long do lifts typically take to heal?
The sutures need about 6 weeks to feel more comfortable that the sutures have already done their job, and the skin is about 50 to 70% of their original strength. So, but in about 2 months, the scar starts to fade, and you should be comfortable to go back to your activities of daily living. In the gym, in about a month, you can start going to the gym if you've had a lift. Those incisions are big, but with a good support bra so that your breast is supported and it's not weighing on the incisions, you're good.
Amazing. So it's pretty good.
But you see the results right away.
Yeah, definitely so.
Yeah.
For how long do you recommend I wear my faja?
3 months.
Can a tummy tuck improve my posture or reduce back pain caused by weak core muscles?
No. The tummy tuck, the job of a tummy tuck is to remove extra skin. That's all. It doesn't give you shape. Now, if you have a lot of skin, very heavy, yeah, it might help. But nothing improves your posture other than good exercises that increase your strength. Pilates is a good thing for posture and core strengthening. So you really need to put in the workouts.
How does breast tissue density impact implant placement or surgical technique?
Dense breast tissue is not a bad thing. It helps me. It's the type of tissue that does not. Well, again, let me go back at this a little bit. Again, dense breast tissue needs to be evaluated by an ultrasound and by a mammogram, so that we make sure that there's nothing, again, that lesion that we're missing. Dense breast tissue is harder to work with, but again, I will examine your breast and see what type of tissue it is, and then I have to distinguish between one patient and another, and how big the implant I put in there, the amount of tissue that we remove, the amount of skin we remove, so that we don't end up shooting ourselves in the foot and affecting the blood supply. So across the board, first I have to understand how much volume I have to give you with an implant, or if you need an implant at all, and then respecting the blood supply to the nipple and respecting the blood supply to the rest of the tissue, because I do have to divide the tissue into separate parts to be able to move them around and get the nice projecting shape of the breast. So dense breast tissue does pose a little bit more of a challenge, but again, that's why you're going to somebody that knows their anatomy, has had experience with different texture breasts. More dense breast tissue actually holds up better. It gives you more volume than a more fatty breast that is, softer. But all in all, the idea is, you have to examine the patient and decide what's going to be the strategy for one versus the other. And again, it just goes back down to experience and anticipating from prior knowledge of working with patients with very similar tissue, and again, respecting blood supply and knowing how much skin to remove so that you don't end up having a problem closing. Okay?
So we have a question here that says, how long after surgery does the final shape and fat retention become possible after a BBL?
About a month. About a month.
During a Lipo 360, do you sculpt the flanks and lower back differently depending on the patient's torso shape?
Well, I mean, I have to go down to the point where, I mean, I remove fat to the point where it's safe. So if your bone structure is different from one patient to the other, some people are narrower, like I said earlier. My goal is to remove that stubborn love handle area, anterior abdomen, the flanks. The closer we get to the removing the deep and intermediate layer, the skin lays better and we see your deeper structures. So you will show what's really under there. Your muscular and bony anatomy will show off better, and that annoying fat is not in the way. So you will, whatever God gave you will just look so much better without that fat deposit that's around the love handles, on the flanks, and the armpits, and the underarms. So the idea is exposing what's under there, okay, giving you the most athletic look possible.
Of course, I love that. How do you handle patients with previous abdominal surgeries or hernia repairs?
Okay, so a lot of times we will ask for a CT scan. So if you've had an exploratory laparotomy, so somebody had gone into your abdomen for whatever reason, or you've had some trauma or whatever it is, a hernia that was repaired for whatever reason, I very, very frequently will ask for a CT scan, and not just a report. I respect the report from the radiologist. I will be more than happy to have the written report, the typed report, but I need the CD or the thumb drive that shows me the actual images. Just like the ones that the radiology looks at, I want to see it myself because I would like to read the images and see what your anterior abdominal wall looks like from different views, so I can decide the safety of the procedures so that we do not run into any surprises, whether we're doing a tummy tuck or we're doing a liposuction, so that there's no surprises, especially if you've had an abdominal surgery and you've had a hernia repair. I answer emails all the time from the staff, and if there is any suspicion from the images that there's a bulge that might be suspicious for a hernia, I need to know, and so that we don't run into trouble. And a lot of times if you've had abdominal surgery, there is a risk of having hernia hiding there that you might not even know about. Yeah.
So informative, doctor. Thank you so much. Do you place the implant under the muscle or do you use another method, and why?
Okay, so I don't go under the muscle anymore. I don't like going under the pectoralis muscle, which is the chest muscle. I think that is unnatural. It causes the implant to animate. It causes the implant to move more to the side and drop to the side more. I get better cleavage with putting it under the breast tissue. So it's not in the breast tissue, it's under it. So it's above the muscle, under the breast. And I think you're augmenting the breast, so I don't see any reason to go under the muscle. And it's never ever really under the muscle, it's partially under the muscle, and I don't think there's any real advantage to that. And the disadvantage I've seen is I've gone in a bunch of times and the implant, with the action of the muscle, it displaces downwards and outward, and I don't like that side fullness that happens. So I really, my preference is to go completely under the breast tissue. It's called subglandular, gland being referring to the gland, which is the breast. And I go through the skin in the inframammary fold, which is my favorite access. I don't like damaging the areola. And it's a direct vision. You can raise the breast tissue and put it on top of the muscle. I think that allows the breast tissue to drape the implant and gives a very natural result. And you add, the augmentation obviously is augmenting the purpose is to augment the breast tissue, and I think that enhances the breast tissue without the issue of animation. I really dislike the animation, the complication with that, where if you flex your muscles, that implant moves. It's just very unattractive.
Yeah, of course.
Yeah.
And how long would you say that a breast augmentation like the surgery takes?
Everybody's different, but about an hour. Yeah, from beginning to end.
Okay, so what's your approach to creating a natural looking belly button? Do you reconstruct a new one during a time?
Okay, it's your own belly button. I cut it out. I cut out the natural shape of your. I put it on a stretch. I mark it, and whatever shape it has, I try to maintain it, and then I make an. Well, I reconstruct it really. What I do is I core it out. It stays stuck to your abdominal wall because the belly button is an anatomical landmark that does not change. It stays stuck in most situations, unless you have a very high one. And then I pull down the skin, take out the extra, and when we're closing, I reach in and I find the appropriate place for it. There is landmarks that I use, and I make a hole for it. My preference is to make it a vertical ellipse. I don't know if that helps, but it seems that they come out more natural and patients are happy with it.
Oh, great. Okay, so we have our last question here, you guys. I see we have one more question right there, so I'm gonna go ahead and read it before I ask him this question. Maribel, does he charge for consultation in person? No, you guys. Lucky for you, you can get a consultation with Dr. Gurani in person, and you can get a board certified surgeon's, a professional surgeon's opinion for free. So let me tell you right now, if you didn't know, you can get a virtual consultation for free or an in-person consultation for free. So don't waste any more time. Right now we have amazing specials going on. So you know, you can reach us out through DM, or you could, for the people on our TikTok, you guys could go ahead and leave your information in this yellow folder that you see right here in my left bottom corner. You just click it, put your name, your phone number, and your email, and we will be getting in contact with you. Okay, you guys? So the last question is, can I add a vaginoplasty to my BBL?
Yes, you can. I have decided in consultation with the surgeon who happens to be my wife that does the vaginoplasties, labioplasties, that combining a BBL or liposuction or a mommy makeover with a vaginoplasty, labioplasty is a safe procedure, and it does not really add that much to the recovery of the patient. So yes, you can.
Amazing, you guys. So thank you so much. Oh, look, love Gurani ×2 Dom, just shy. We love to see it, you guys.
Thank you so much. It was a pleasure answering your questions, and we'll do a live very soon. Okay, nice to see you guys again. Take care.
Thank you guys so much. We'll be back very soon. Stay tuned. Bye.